Are you curious about ABRYSVO? This groundbreaking vaccine has been making waves in the medical community, offering protection against respiratory syncytial virus or RSV for both infants and older adults. If you're looking to learn more about ABRYSVO, you've come to the right place. In this video, we'll delve into the top 10 facts you need to know about this innovative vaccine. Respiratory syncytial virus, or RSV for short, is like the neighborhood troublemaker of viruses, especially when it comes to the respiratory system. Think of it as the unwanted guest at your body's party, causing all sorts of chaos. Now, when RSV decides to crash, it usually brings along a bunch of unwelcome symptoms. For starters, it loves to mess with your respiratory tract, causing a range of issues from a pesky cough and a runny nose to a full-blown case of wheezing and trouble breathing. It's like having a congested traffic jam in your airways. And don't think RSV stops there. Oh no. It can also lead to fever, sneezing, and even poor appetite, making you feel downright miserable. Plus, if you're dealing with a little one, RSV can be extra tricky, often leading to fussiness and irritability. But here's the kicker. While RSV might just seem like a common cold for most healthy adults, it can hit certain folks harder, especially infants, older adults, and those with weakened immune systems. In these cases, RSV can escalate into more serious respiratory infections like bronchiolitis or pneumonia, landing you in the hospital for more unwanted R&R. Now, let's take a look at ABRYSVO. Number 1. What is ABRYSVO? ABRYSVO is a vaccine specifically formulated to combat respiratory tract infections caused by respiratory syncytial virus, or RSV. RSV is a prevalent virus known for causing serious respiratory illnesses, especially among two vulnerable groups, infants and older adults. ABRYSVO operates by prompting the body's immune system to mount a defense against RSV. Essentially, it acts as a proactive shield, training the immune system to recognize and neutralize RSV invaders before they can cause harm. By stimulating this immune response, ABRYSVO serves as a powerful tool in preventing RSV infections and safeguarding individuals from the potentially severe consequences associated with this common viral pathogen. Number 2. Who is ABRYSVO for? ABRYSVO is primarily recommended for two groups: pregnant individuals and adults aged 60 years or older. Pregnant individuals receive the vaccine to protect their infants from birth through 6 months of age, while older adults receive it to safeguard themselves against RSV-related respiratory illnesses. Number 3. How does ABRYSVO work? ABRYSVO contains a protein antigen from each of the two subgroups, A and B of RSV. By introducing these antigens into the body, ABRYSVO stimulates the immune system to produce antibodies against RSV. This immune response helps to prevent infection and reduce the severity of symptoms if exposure to RSV occurs. Number 4. Administration of ABRYSVO. The administration of ABRYSVO involves a straightforward process: a single-dose injection into the muscle of the upper arm, skillfully administered by a healthcare professional. The timing of vaccination varies depending on the target population. Pregnant individuals typically receive ABRYSVO in the late second or third trimester, a strategic time frame chosen to maximize the transfer of protective antibodies to the developing fetus. Conversely, older adults receive a single dose of ABRYSVO to bolster their immune defenses against RSV-related respiratory illnesses. This precise approach to administration ensures optimal protection for both vulnerable populations, underscoring the importance of strategic vaccination efforts in safeguarding public health. Number 5. Safety considerations. Before receiving ABRYSVO, it's essential to inform your healthcare provider about any allergies or medical conditions you may have. Individuals with a history of allergic reactions to vaccines or any of ABRYSVO's ingredients should not receive the vaccine. Additionally, pregnant individuals should consult with their healthcare provider before vaccination. Number 6. Side effects. As with any medical intervention, ABRYSVO, while generally well tolerated, may elicit side effects in some individuals. Among the most frequently reported side effects are localized reactions at the injection site, such as pain, swelling, or redness. Additionally, individuals may experience muscle pain and headaches following vaccination. While these side effects are typically mild and transient, it's crucial to remain vigilant for any signs of severe or persistent reactions. Although serious allergic reactions to ABRYSVO are rare, they are not entirely unheard of. It's imperative to recognize the signs of an allergic response, which may include difficulty breathing, swelling of the face or throat, hives, or a rapid heartbeat. If you experience any of these symptoms following administration of ABRYSVO, it is vital to seek immediate medical attention. While the occurrence of side effects should not deter individuals from receiving ABRYSVO, it is essential to approach vaccination with awareness and caution. By remaining vigilant for potential reactions and seeking prompt medical attention when necessary, individuals can ensure their safety and well-being while benefiting from the protective effects of ABRYSVO against RSV-related respiratory illnesses. Number 7. Storage and handling. ABRYSVO should be stored at a temperature between 2 degrees Celsius or 8 degrees Celsius or 36 degrees Fahrenheit to 46 degrees Fahrenheit in the original packaging. It should not be frozen, and any cartons that have been frozen should be discarded. Proper storage ensures the vaccine remains effective and safe for administration. Number 8. Effectiveness. Clinical trials have demonstrated the effectiveness of ABRYSVO in preventing RSV-related respiratory illnesses in both infants and older adults. However, it's essential to note that no vaccine provides complete protection against all strains of RSV. Despite this, ABRYSVO offers significant benefits in reducing the risk and severity of RSV infections. Number 9. Additional monitoring. ABRYSVO is subject to additional monitoring to ensure its safety and effectiveness. This ongoing surveillance allows for the quick identification of any new safety concerns or adverse reactions associated with the vaccine. Healthcare providers and individuals receiving ABRYSVO are encouraged to report any side effects or adverse events to the appropriate authorities. Number 10. Availability and distribution. ABRYSVO is available by prescription only and is distributed by Pfizer Australia Proprietary Limited. Healthcare providers can administer the vaccine in clinical settings such as doctor's office, pharmacies, or hospitals. Availability may vary depending on location and healthcare provider recommendations. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!